Hello, welcome back to another video of What's Up Doc. Today I decided to share with you guys my story, my relationship, my history with Botox. Since I uploaded a video about the nature of Botox and the process of Botox, I thought sharing my story will help some of you guys decide, especially if you're considering that kind of injections. So Botox has two different applications, obviously to smooth out the wrinkles, and that's what they're known for. But also recently, Botox had a very successful application for a TMD patient that are having a lot of challenges with their clenching and grinding, tension of the muscle, locking of the jaw, a lot of headache from clenching and grinding, and compression forces on the muscle and having those muscles constantly engaging or being engaged all the time. So injection of the Botox in these muscles will help those muscles relax, and as a result will actually relieve a lot of the clenching and grinding symptoms and the migraine symptoms some of the patient are getting from clenching and grinding. But also it depends on the headaches that you get, whether you have more frontal headaches right here, or the headaches are originating from the temporalis muscle, or the headaches are coming from your neck or from your jaw. They will definitely evaluate you and trace that and will inject you accordingly. So my journey with Botox started with, I think in 2002, 2003, after my surgery or after my pregnancy, because I was on high doses of progesterone and I had side effects from that. One of the side effects is rosacea, a very severe case of rosacea, and I decided to see a dermatologist for it, and a couple of dermatologists that I saw in the beginning, they couldn't really help me that much. So when I moved to Massachusetts, I saw a dermatologist that in their office, they offered Botox injections, and mostly was for cosmetics reasons. But at that time, I guess when I was complaining and I walked in one day for my visit, and I just had a huge migraine series that weekend, and I didn't look good. So he asked me, he said, what's going on? So I told him about my history of migraine, how it runs in my family, my mom, my sister, my aunt, like I mentioned in the other video. All my female lineage had suffering with migraines. So he asked me, he said, why don't you do Botox? And at that time, I was 37 years old. And I looked at him, I was like, I don't need Botox. I don't even have wrinkles. He goes, no, that's not what I'm talking about. We're getting a lot of research, a lot of data. Botox is helping with migraines, because I tried everything with migraines. Even I tried injecting myself with Emitrex during an migraine episode, and I had a side effect from that. I had a severe side effect to the point that it magnified my headaches so bad. I was banging my head against the wall, and my husband almost took me to the emergency room, and then they give me like Dumerol to calm me down because it was so bad. I had that migraine. That specific episode, I had it for like 3 days. It was like debilitating. It was horrible. So he talked me into it. I said, all right, I'll try it. He said, listen, try it. If it doesn't work, don't do it again. So I was about 37, 36 years old. And I said, fine. So he injected me with Botox. And until this day, the moment I get Botox, especially in the frontalis, like right here, temporalis muscle and frontalis muscle, all the way across. Like I said, I didn't see a difference. Obviously, I didn't have like wrinkles or anything like that back then. But at the 6-month mark, my headaches will come back. So I know that, and that was way before my hysterectomy, so I knew that it was working, and so I kept going. So I've been getting it since I was 36, 37 years old. Now, keep in mind, when you get older, you have to do it a little bit sooner than 6 months. You have to do it every maybe 3 to 4 months, because again, the muscle, everything ages, and the muscle reaction or response to Botox is a little bit different. But since then, every time I took Botox at the 6 month mark, my headaches will start, and I will remind myself, oh, it's time for my Botox injections. So The other application, obviously it will smooth things out for you, like I said, but I don't recommend anybody getting it at age 25, 24, 25. That's way too early. And I know that they're selling the whole idea of Botox to a younger crowd as a preventative thing. So let's prevent things from happening. Let's prevent things from sagging. Let's prevent things from wrinkling. But I think that's way too early. Maybe mid-30s, especially if you are using it for migraines. I think that would be very helpful, because if you think about it, the childbearing age is like 25 to 35. And that's like your peak of hormones changing and hormones just going through the cycles of hormones. And because it's the childbearing age and your body is at its prime, you know, reproducing and making babies. And some of us have, you know, gone through the fluctuation of hormones with the higher frequency of a migraine incidences. So, or episodes. So I would say personally, because number one, if you genetically predisposed to migraines and it runs in your family, and you know every female in your family had migraines and nothing helped, if pharma helps, the prescription help, that's fine. But if you can, if you can directly inject that muscle to relieve that tension, why not? I would, you know, like I said, you're killing two birds with one stone, which is, you know, helping everything relaxes and preventing the wrinkles from forming and aging of the muscle too. And also at the same time, eliminating the high possibility or high frequency of migraines or headaches. So, you know, 35, 36, especially if you are constantly getting headaches, that's great. And you just have to keep it up, because personally, I've noticed that at the cutoff date of me having to get Botox, or I'm due for Botox, the headaches will come back. So that's as far as the headaches. So all these years, I'm 52. The last 2 years, I have been getting Botox for my jaw. I do clench and grind, and I do clench most of the time, all day long. But I do a night guard. I wear a night guard at night. But it got to the point that when first thing in the morning when I wake up, and I'll put like a spoon, you know, to eat my yogurt or whatever, it almost will lock on me. So I got really, really nervous. So I see Dr. Lisa Voyich at the Renew Med Spa in Derry, and you have to find the right provider and the right clinician that's comfortable injecting for TMD, Botox for TMD. So I reach out to her and I asked her, and she said, yeah, absolutely. We do it all the time. So the nice thing about her, she did not just inject me, she evaluated the masseter muscle, which is the largest muscle in your face that holds the jaw and swings forward and back. And she checks for NOS, and she checks how, you know, the percentage of that muscle engagement. And she will customize the cc's of the Botox and those muscles to relax them. So I got 2 sessions last 18 months apart sessions, I think. And it's so much better. It's almost like 20-30% better as far as the muscle relaxing and not engaging all the time. So even if I try to clench my teeth together, it will release and it will let go. It will remind me to let go. So my jaw is a lot more relaxed. The muscles are a lot more relaxed. I don't have knots, thank God, in masseter, and those be so painful. Clicking and popping on the jaw, which is mostly the joint, I have a little bit, but there's not much you can do. I've heard that they can actually inject in the joint to, you know, just put a Botox, you know, bubble around it. I don't know how exactly it works, but I never tried it. Because no oral surgeons these days, which they used to do in the 90s, they used to do an invasive procedure through the this side right here into the jaw, and they try to clean a lot of the scar tissue in the joint, but they don't do that anymore. And that's why the Botox, I think, application became a lot more popular. But that's my story. And with Botox, I hope this helps for some of you guys that are considering Botox, whether for migraine headaches or TMD symptoms. And I had a great experience. It was very, very effective, and I'm glad I did it. So I'm out of time. I'll catch you in the next video.